Okay, so next up on the agenda, the loose agenda that we have, I don't like to keep these to I think the purpose of a good town hall should really be feedback back and forth and conversation, not just us standing up here telling you all the information that if you've watched our meetings you probably have gotten anyways. It's rather a better idea to have a conversation with people and hear what's on their minds. But I do think it's also important to present some information. And when we have a guest from the county to have him speak for a moment on some important things that are going on. And with that, I would like to introduce Dr. Marcus Plescia, who is the Mecklenburg County Health Director. He's been here now as Health Director for 8 months? Over a year. Time flies when you're having fun. So, Dr. Plescia, please come on up, and we've got a couple of things, some handouts that I'll tell everyone about once he's finished. But I know he's got a couple initiatives that are going on, and we give you an opportunity to tell folks about it. So thank you very much.
Thanks for having me, and thanks for your time. We have three main things I thought I would update people on. One of them is the rollout of the county's tobacco ordinance that will roll out on March 18th, and it will make smoking prohibited on the campus of all county government buildings. That's the county, the city, and all four of the towns. And then there's a second ordinance that will make tobacco use prohibited in some of the park system with an exemption for the 20 regional parks. So that rolls out on March 18th, and we are in the process. You'll start to see some of the signage going up for that. I get asked a lot of questions about the tobacco ordinance, one of which is how do you enforce it, and we are not the first community to do a tobacco ordinance of various types, and so we have quite a bit of experience, and generally if things are well signed, if people understand what the rules are, they follow them, so that's the reason for making sure that there's good, strong signage. The other two things I wanted to talk about are, the tobacco ordinance is actually cancer related. I mean, tobacco is a cause of a lot of the chronic diseases we see in our community. The other two things that I want to talk about are specifically cancer-related. Cancer control is an issue of great interest to me. My previous job was running the national cancer programs for the Centers for Disease Control. And so there are two issues I want to talk about. One is the county has a breast and cervical cancer screening program that basically provides free screenings for anybody who doesn't have insurance, for women to get mammograms and pap smears. And this is a great service. We estimate that there are probably 24,000 women aged 40 to 64 in Mecklenburg County who don't have insurance. And for some reason, this just seems to be a well-kept secret, and our clinics right now are sort of sitting unfilled. I mean, we're kind of having people trickle in. So we are really wanting to get the word out, and we've got some pamphlets out there. And please, I mean, my concern is if we don't meet the numbers on this program, the funding comes from the state by the federal government, and they'll cut the numbers back. They'll say we don't need it, and I mean we clearly do need it. And I think it's just a matter of getting people aware that this is there. So if you have contacts that you can give this out, I would really appreciate it. The second cancer I want to talk about, March is Colon Cancer Awareness Month, and of all of the screening tests that we have for cancer, in my opinion, probably the best cancer we have to screen for is colon cancer. I mean, not only is the test, so if you are over the age of 50, you are eligible to screen for colon cancer, and it is probably one of the tests that we have the most effective ability to find colon cancer early. And colon cancer, when it's found, is almost 100% treatable. So it is, just a great tragedy to me when I hear stories about people passing, particularly when they're quite young, from colon cancer. The other great thing about colon cancer is there's actually two tests to choose from. Everybody knows about colonoscopy. A lot of people don't know that the other option is a take-home test that you do once a year. You take a sample when you go to the bathroom. So, two opportunities to have people screened, and I'm hoping this month to really kick off some information about colon cancer, because it is Colon Cancer Awareness Month, but it's my intent that the health department is really going to stay on that message after this month, and our screening rates in this community are 60%. Breast cancer, 80% people participate in breast cancer screening. Cervical cancer, it's almost 90%. we need to get that 60 up at least closer to 80, and I think we can do it. And I'm determined to have that happen, and I would really appreciate any help getting the word out. And if you're over the age of 50, please consider that screening test. I really do strongly endorse it. So if you'd like me to be open to questions, I'm happy. I don't want to.
No, absolutely. If you have questions, please.
Dr. Plescia, on the colon cancer, is it more common among men or women or age? Could you give us any information about that, or race, so that we could be aware of that?
So colon cancer is most common in people over the age of 50. That's why we start screening then. It's not to say that people don't sometimes get it earlier. In fact, we are seeing an uptick in people in their 30s and 40s getting colon cancer, but not enough of an uptick that it justifies doing a universal screening program for that population. If you have if you have risk factors, then the situation is different. Slightly more common in women than men, as is the case with a lot of the diseases we see. They tend to be more colon cancer is more common amongst African Americans and many other minority communities. Also, as with anything, if you're poor, you're more likely to get sick than if you're not poor. So people who have lower incomes tend to suffer more from colon cancer. And not only the occurrence of colon cancer, but clearly all those groups I said, if they get colon cancer, those people are going to do worse.
Is the colon cancer screening free also?
No, we're not yet. We're working on that. But right now there is a federal program. These federal screening grant programs come through the state, and the state of North Carolina was not successful in the last competition, but it is being recompeted in a month. So I'm hoping the state will get some money, and that will mean that there'll be some money coming to different county health departments.
From a broader sense, is there any connection or correlation between tobacco use and colon cancer?
Yeah, tobacco use is correlated with a lot of things, and I think 2 years ago there was a reissuing of the Surgeon General's report on tobacco. The first Surgeon General's report came out in the 1950s, and that's when there was really this definitive evidence of some of the health effects of tobacco. They did a sort of update of that 2 years ago and added a number of cancers for which there's now definitive evidence that tobacco use contributes to people developing those cancers, and colon cancer is one of those.
Dr. Plescia, could you talk for a minute about what we've talked about recently about about 13-year-olds starting to drink, and also that that's the big age group, the 13 to 17 and over 50? Because I think people have children, nieces and nephews and grandchildren, and they need to be aware of that.
Yeah, kids get up to all kinds of mischief these days, and certainly one of the ones that we've been seeing is this uptick in use of alcohol and other drugs, and also kind of that's happening earlier and earlier. So that's an obvious problem that I don't have to speak to. The other issue that is probably the issue that's most on the public health radar screen now is binge drinking, and you tend to see that a little bit later, late teens, particularly college-age kids, and that's when people, are not just drinking; they're drinking very, very heavily, and that's a concern for health reasons. It's also a concern because, as everybody knows, the people who are drinking in significant quantities are much more likely to have injuries, accidents. So that is, but we are seeing the numbers, particularly of binge drinking, really just going up phenomenally. I mean, it's almost an epidemic proportion, so it's a big concern. Am I getting at what you wanted me to speak to on that?
Well, I just, I know that Talk It Out campaign that the Department of Health and Human Services is promoting about talk to children younger about, because the average age was, I think, 13 years, 10 months for kids to start drinking, which, surprises a lot of people. And I just think it's good that people need to be aware to, don't wait until they're 17, start earlier, because that's when it's happening here in North Carolina.
Yeah, experimenting with alcohol, experimenting with drugs, experimenting with sex, those are all happening. Starting to talk to kids about that 10, 11, 12 years of age is appropriate.
This might be a bit of an off question, but the vapors, smoking nowadays. What is there being? Are there any effects you know, what I'm talking about, the vapor cigarettes? Explain that, and other than creating the habit of, you know, the oral and the hand fixation of it, is there a detriment to it?
Yeah, so we're talking about electronic cigarettes, vaping. You know, the word is out on those. I mean, we don't have a lot of evidence about what the potential health effects might or might not be of electronic cigarettes. The things that are of concern to people is electronic cigarettes have a lot of nicotine in them. And nicotine is what is the addictive thing that's in tobacco. That's what people get addicted to when they smoke cigarettes or chew tobacco or anything else. And so, you know, the addiction is definitely there with the use of electronic cigarettes. There's not a lot of the other things that are in a combustible cigarette are not in electronic cigarettes, and that's good. But then the nicotine in the electronic cigarette is dissolved in this liquid that we don't know much about that either. And all of this stuff is being breathed in by people. So, you know, I don't want to say that we're sure they're bad because we really don't know. But I mean, I am, you know, I'm cautiously concerned about them because we just don't have. What we don't want is another situation of what happened with cigarettes, where, you know, we didn't know that they were bad. People didn't know they were bad for you. 50-60% of the population was smoking, and then we learned that they are major health hazards. So those of us in public health, the reason we have some caution around electronic cigarettes is we don't know. We don't want to end up 10 years down the line in the middle of something that then we got to backtrack on. So that's a long answer, and I'm afraid it's not very satisfying. You've got a question about that?
I'm not going to ask you about Florida.
Please don't ask me about
heroin use. I know that I had a town hall about 60 days ago, and Chief Monroe spoke, and this pertains to Matthew's district and my district. And a lot of South Charlotte is seeing an increase in teenage use. Do you guys track that? Are there any collaborative efforts with CMPD? Is there anything that, you know, the county is doing on a prevention side? I'm just
We don't do an enormous amount around that, and most of the tracking from the public health side is done at the state level.
okay.
So you know, it's not something I can speak with great authority on. I mean, we are seeing this uptick in the use of heroin, also the use of recreational use of methadone. And methadone is actually used in treatment of opioid addiction, but now kids have figured out you can take enough methadone, you can get high off of that too. So there are a number. I mean, it's a lot more dangerous to be a teenager these days than it was when I was one. Some of these, heroin is a really scary drug, very addictive, and when it's used as an IV injection, it sets people up for all kinds of potential infectious diseases. It's very concerning.
Do you actually have numbers showing a correlation between banning smoking on campuses and in public parks and the cancer rates of the population?
We don't have numbers about any kind of attribution because nobody's been doing it that long. I mean, there's cancer, generally there's about a 10-year lag before we used to think it was a lot more than that, but California has been doing a lot of tobacco control stuff for a while. And so there's about a 10-year lag, and the kind of things we're talking about, banning on campuses, banning in parks, nobody's been doing it long enough that there's data on that. I mean, it's based on the bans like these that are outdoors are really more about changing social norms, really changing people's perception of tobacco use and sort of getting at this issue of, the old issue that smoking's cool. It's really about turning that around. It's not as much about secondhand smoke exposure, which is what the restaurant and bar bans were about. Although, if people are in a park for a concert and they're sitting in a big group, there is secondhand smoke exposure in that situation. But we don't have a lot of data on even the early communities that did stuff like around outdoor bans. The data's not in it. It's too early.
Speaking about e-cigs, are those part of the tobacco ban?
They are considered a tobacco product by the state of North Carolina, so they're part of the ban in the parks. But the ban on the government buildings is only for smoking, so they're not part of that.
Kind of going back to the vaping topic,
does anybody, and this may be more of like a local government issue, but what kind of news are we hearing about regulation, whether it be via FDA or locally and things like that? Because I know, and the reason I ask that is because, I think some people feel like, okay, it's just vaping, and so I can do it in this restaurant or whatever, but have we talked about that as far as from regulation?
Everybody's waiting for the FDA to rule on this. I mean, the FDA is the entity that looks at the science of things and tries to figure out with things like tobacco products and vaping, what the potential health effects is and what kind of regulations there should be. And they have not ruled. I think that there's difficulty kind of getting to the bottom of what potential health effects might be. And it's frustrating. I'm not sure why that's been so slow coming, because it would be nice to have a little more clarity on this. A lot of restaurants that have had the smoking ban that was put in place on restaurants and bars, a lot of them are very uneasy about this. I mean, they've sort of gotten used to the ban, and now people are vaping, and strictly speaking, it's not a cigarette, so the law doesn't apply. Now, a restaurant owner can decide what is allowed and is not allowed in their property, and so they still have the potential to make those policies. But the actual, when we did the restaurant and bar smoking ban, what a lot of restaurants told us was they really did want to stop smoking in their restaurants, and partly because of their employees, but they really did want the law. They wanted the law because the law helped them be able to tell people, if we can't do this, it's because there's a law, and it makes it a little less confrontational with their customers. So I think a lot of those businesses are very concerned about the vaping issue too, but we just don't have the data, and I don't want to, I'm concerned about them, but that's a little bit my prejudice as a health professional. I think we need to wait and see what we learn. The thing that is concerning about electronic cigarettes is, we've done really well with kids and beginning to lower the use of tobacco products amongst kids, but we're starting to see those gains eroded now because, kids are really attracted to electronic cigarettes. They're gadgets, and kids like gadgets. They're being portrayed as very cool, they're marketed as kind of fruit flavored, and all of this stuff that's appealing to kids. And we're seeing the rates of electronic cigarette use in kids going up at the same time that we're seeing smoking rates of conventional cigarettes going down.
So do you know of any talk of maybe changing the subject just a slight bit, but still health related? Any potential regs come down the pike here in this county about trans fats, sugar, salt, the Mecklenburg, stuff like that, or is that off the table, or you know anything?
Well, the first time I met with Commissioner Ridenhour, we talked about the soft drink ban in New York, and I assured him that I am your health director. I don't think it should be any great surprise that I would be active around tobacco. It is a health problem, and I know there are mixed feelings about what we should and shouldn't do. But I'm the health director. I'm going to push for everything I can on tobacco. I'm not going to push on the regulations we put in around tobacco are based on some evidence. I don't know. Banning big sizing or banning soft drinks, I don't know. That might help lower obesity rates. It might not. There's really not any evidence out there.
There's so many ways around it. You can still.
Yeah, who knows? I wish they had done it in New York.
It's just reality.
I wish they'd done it in New York because we could all see, did it work, or what was the effect? Trans fats there is a little more evidence about banning trans fats in restaurants, because a lot of people, you don't realize what your food's being fried in, and it's best to not have it fried. Trans fats do clearly have some cardiovascular effects. It's not something that's on our radar screen right now to look at in Charlotte, I think. But there's been some interesting stuff around working with restaurants voluntarily to lower salt levels. Particularly some of the ethnic restaurants, Chinese restaurants, have very, very high salt levels, and they've done some stuff to build it. But that was voluntary; it wasn't a regulation. And actually, interestingly, the restaurants have been very participatory in that. There's been a lot of interest, a lot of willingness. So we might do something like that. But I think those kind of things, I'd like to see that done on a voluntary basis, and I think we would have a lot of businesses that'd be happy to do